I'm Gurmit Singh Chugh. I'm Managing Director of Transilumina Therapeutics. We are a company based out of India and have global operations and have facility in Dehradun in India and Hechingen in Germany. So as soon as the lockdown happened, the crucial decision before us was that do we operate and continue our business so that we are able to supply the essential services and the life-saving devices business which we are in, or we close down and at this be like any other business that would not really want to take many chances with the employees, many chances with a lot of other logistics, which became a major challenge. So I think within our senior management, everybody wanted to. We discussed it, and everybody decided that I think this is a time where we should really take this challenge and continue with the life-saving devices, because we were sure that since we are in a business of cardiac devices, there could be a possibility of increased uh, demand for cardiac devices due to the stress caused by the COVID 19, and maybe there is an interrelation or not, which was still unexplored. So the first thing which we did was that we looked at all the various operations regarding our business and tried to see what are the challenges. Now, one of the major challenges in the facility was that there was still not a clarity whether facility can be opened or not, because there was a confusing signals with regards to the attendance of the employees. At the same time, there was no public transport. So, which means if you don't have a public transport, you cannot have your people reach your facility. And the same thing was also there in the warehousing and the operation. So the first thing which we did is that we prepared our team as per the World Health Organization's COVID-19 rapid response and preparedness plan, and gave extensive training to the warehouse and to our operations team to ensure that at least whatever we are functioning as per the guidelines with utmost safety for our employees. Within the facility, we reorganized our shift system, uh, created the distance in terms of the clean rooms while the people are working within their desks, within their operating areas, the correct distancing. So, what happened was that instead of we operating in one shift, we have to divide the employees and then we have to work in three shifts. But this is the challenge which the team took, and I'm very happy that today we were operating in almost 100% of our efficiencies, and we have enough stock which we have built for the future. In terms of the our operation and warehousing, we are very happy that we were almost in the whole month of March and in April so far. We have been able to cater to almost 98.5% of our orders. Uh, I was humbled by the cooperation of the team and their enthusiasm to really help the overall system in this situation. People were traveling long distances on the car because since there was no cargoes, planes which were available in a lot of places, so almost 600-700 kilometers was trekked, on personal cars because there was no other, public transport which was available. And I think the something which humbled me a lot is that was one of my representative who was in Bihar traveled almost 300 kilometers on a bike to deliver a consignment in Muzaffarnagar, and I think that was just the commitment which the whole team had towards ensuring that under no circumstances we will compromise with the availability of these life-saving devices to the patients. I think a major issue which, as we move forward, should be a realization for the government is their dependency and on the importers and their dependency on multinational companies selling products in India, and the lack of preparedness since last several years of not making a plan for ensuring that the domestic industries grows. Today, it's a big realization that the people who have opened their facilities, the people who have worked hard, the people who would have delivered the products to the hospitals, and you check hospital by hospital, would be the domestic companies. Even if for the PP kits, for the other ventilators, if the action should have happened 6, 7 years back, which we have been propagating along with Ahmed, today it would have been a different scenario. So one of the biggest lesson, not only for government, for NGOs, for society, and also for manufacturers, is, whether they are Indian or when they come from abroad, is to manufacture indigenously. And the countries who have not uh, really impacted, and the countries who have not really have a plan to have our own domestic manufacturing of all critical equipments and medical devices and pharmaceuticals, ultimately we would see that these pandemics will catch the country totally unprepared, and our dependency on other countries shouldn't be at the level which is today. Today we are running away to give custom duty relaxation, we are running away to give import relaxations to solve our issues. But this problem shouldn't have happened if we would have focused on the domestic industry. But I'm saying this is still the right time. Healthcare is going to change like anything post COVID, and it is the right time to consult with the domestic industry and to just give us some easy access to decision making, easy access to those meetings where we can come and talk about the issue which we are facing. And I think we can have a very vibrant domestic industry for future, which should which should be India, which will make India very proud, and India will be prepared for all such kind of exigencies in future. Right now, it seems that this lockdown is not easing up very soon, and there are huge challenges which we are facing on a day-to-day operation. So, one of the major challenges that in the lack of supply, in the lack of cargo planes working, in lack of this couriers working or public transport, I think it will become a challenge to sustain this for a very longer periods, because at the end of the day we are dependent on the delivery of the timely products to hospitals, and we are also dependent on timely delivery of products to us. International cargo has become very costly, and with the cancellation of the flights, a lot of raw materials which had to be imported from a lot of countries cannot reach. So we are looking at the alternatives. Number two is, I think, from a government perspective, I feel that the government should have been involving the Indian companies more compared to what they are doing today. Um, Most of the actions which have happened so far has been a quick fix action, where you just give a little relaxation on the custom duty, you eased out imports, wherever you give a this is like a very clean signal that the government is still wanting to depend on solving the situations by importing the products and depending on other countries. But let me tell you very clearly, other countries have their own priorities. I mean, they can put a ban on the exports like the way we have put a ban on the exports of critical equipments which are required today. They can also do that. So this is a time to take very important decisions with regards to the domestic industries. And most important of all, we would have expected them calling all the domestic industry together. I mean, having a consultation with them and easing out the issues. The third is that as if the public transport is not there, one of the things which we feel unsafe is about the presence of the employees. I mean, they need to come. Everybody does not have their own transport. So the people who work in facility, we have been keeping them in hotels for the last 4 weeks, but then we have to find a legitimate solution to this whole issue. And as we move forward, this is also important that most of the regulations which are new, most of the regulations which have been brought up with regards to the various rules of the lockdown, I think a lot of consideration need to be provided beforehand rather than after it, because once it becomes a rule, then we are left with negotiating with the local DMs and the local administration to just get a simple relaxation for the products which will probably become need of the society very soon. I mean, today we are only and only looking at the solution for COVID-19, but the other diseases are not dying soon. Soon you have patients with the gastro issues, you have patients with heart attacks, patients who have coronary artery diseases are today sitting at home, but they are going to come back. And if that time the devices are not available, we will have another issue at hand, which could be even similar or maybe bigger than what we are facing today. So I think we need to sit with the government and has a very pragmatic approach to this whole issue, and not take a knee-jerk reaction where you just create one circular at the end of the day and just announce that these things cannot be done and these things can be done. I think a consultative approach needs to be brought in, and domestic manufacturers are ultimately the ones who can give you the real issues at ground, and they need to be consulted.